My name is Jerry Vitek. I am a professor and head of the Department of Neurology at the University of Minnesota. I'm going to talk about deep brain stimulation devices, differences in the technology across the companies. There are basically three companies that make the vast majority of deep brain stimulation devices that are used in the market today: Abbott, Boston Scientific, and Medtronic. I'm going to talk about each of these in alphabetical order. Let's start with Abbott. This is the directional infinity DBS system. They have two pulse generators called IPGs, IPG5 and 7. They differ only in the size of the battery. Both have MRR conditional labeling. Both are compatible with infinity directional leads and compatible with select Medtronic leads and extensions. They make two directional leads. The directional lead cartoon is depicted in the middle between these two leads. You can see 4 bands labeled 1 through 4. In the middle, the two bands in the middle are separated into bands, split bands, so 3 segments apiece. So they're labeled 1, 2, 3, 4. The segments are labeled 2 ABC, 3 ABC, and of course the ring at the top is 4. The radiographic marker at the top allows you to get an idea after the lead's implanted. You can take an image and you can get an idea of the orientation of the lead in the brain. Now these two directional leads differ only in the spacing between the contacts. The contacts are 1.5 millimeters. In one case, they're separated by 0.5 millimeters, and the other is separated by 1.5 millimeters. The programming system consists of a physician iPad or a patient iPod or iPhone. Currently, the iPhone 6 to 11 are compatible with the app, so the patient can use an iPhone 6 or 11. The 12 is not yet compatible, and you cannot use Androids at this time. I assume that will change soon. These are both Bluetooth, wireless, and the iPad is touchscreen. An example of how to use this system is this iPad is very nice and easy to use. Touch your segments, select your segments, make them anode, make them a cathode, change your parameters. The nice thing about the segmented leads, of course, is that you can change your current flow, and that's depicted by the red little cloud there. Now, the nice thing about the wireless is that you're not tethered to your patient. But what Abbott has done in addition to that is they have now developed a remote programming platform. So you can do your program adjustments remotely. Looking at the iPad on the left, you get a picture essentially of the physician programmer, see the patient, you're in the bottom right corner, you can move your picture wherever you want, but they'll get a picture of you and you get a picture of them. On their iPhone or their iPod, they'll get a picture of you. They can initiate this session. Once they initiate it, they will then hook up with their IPG wirelessly. You will then connect with their iPod or with the iPhone. This is a secure encrypted system, and it has audio and visual. On the right, you get a picture of what you might see when you're hooked up to a patient and you're programming. You get a picture of the patient, you get your parameters, and you can select your parameters and watch the patient. You can make the patient bigger. If they wanted to move their phone further away, you could also get a total body picture of them. If you want to move it closer, you might want to just look maybe at one motor sign, maybe a particular body segment. You have a lot of flexibility with this. Nice thing about this system here is that you can be at home and the patient can be in their office, you can be in your office, and they can be home. As long as you have good internet connection, you can do that. You're able to change your parameters. You can do the program checks, spot checks. You can check the system. It also has the default modes that if you get disconnected, you'll be able to maintain the previous programming setting before you started the session. Let's just give you an example of what you might see. And again, I think it's a very flexible system, and I think this could certainly be a game changer for many patients. Second system I want to talk about is Boston Scientific's. They have 2 IPGs. One is a rechargeable, 15-year battery life. The other is a non-rechargeable. Both of these will take 2 leads. They have two leads that they offer. One is a longer span non-directional lead, which you see at the top, 1.5 millimeter contact separated by 0.5 millimeters. And the bottom is a Cartesian directional lead, 1331 setup. And the top, you see the radiographic marker. At the bottom, they have a rounded tip. The other charging system on the bottom left is set up with a collar. It has a counterweight, and then you also have the charging device on the other side that's placed over the IPG, and basically the patient can just sit there and let it recharge. Simple to use remote control you see in the middle, and then this is the Navigator 4 on the right side. I'm going to show you a little more about that here. Showing you the display of the Navigator 4 on the left, you can choose select target that you're looking at. You can select its left or right side. Right next to that is the lead laid out with the segments and rings. You can select those, obviously easy enough by tapping on them. In the middle, it gives you an orientation of the lead. And you can see the picture of a face in the bottom right. And this is a chrono view, so you're getting a look at that lead head on. And then the red ball looks at the volume tissue activation based on the stimulation parameters you selected. On the bottom, you're looking at an axial view, and again, that little orange line leading out from that white circle, which is the lead, tells the orientation of the lead, and then again, you have the volume tissue activation based on your stimulation parameters. On the right are your controls, and here you can see you can adjust your pulse width, you can adjust your frequency. On the left side, again, you're adjusting your contact segment choices. Nice feature here, it's one-touch control, but also has a interesting feature where you can just rotate your current field. If you look at those highlighted boxes, the four that are highlighted just on top, you have arrows that go to the right and left. By picking the amount of rotation you want, what degree rotation you want, let's say you want to rotate the field 30 degrees, I can select moving it 30 degrees to the right or to the left, for example. And it does that automatically for you. You don't have to change or calculate how much current I need through each of these segments to be able to rotate that field. Again, you can select segments individually, put whatever current you want through each of those, any combination of those contacts. You can program it using a ring mode, so the current can just move up and down, or you can program it using the individual segments, and you get a picture of what those volume tissue activation is going to look like based on the selection of the segments that you use and the current that you're using, and you can see it shifting here. While you're doing those shifts, you can actually do real-time mapping. This shows you from the top down, again, looking more at the top of the head. On the bottom, you see the head depicted, and then you'll see different colors showing which side you're on. If you look at those segments, you have three segments. Again, you see the orientation of this field, and then you see these circles emanating outside. These represent distances away from your contacts, and you can see the direction. Here we've listed it as different levels of current intensity. And you go to the second level, let's say that's 2 milliamps. You click on that, you're just using the one segment. And you'll see on the right side of the panel, you'll see these little squares. In the purple, you see that they're talking about one of the symptoms motor signs. You've clicked on that, you can denote then what kind of benefit you got. You can then shift your current field, for example, and that's the other dots that go to the right and then start moving up. And you can do the same thing there. So at each of these current intensities, you can basically say, what do I have for benefit? Did I get any side effects? The bigger purple with the white circle around it tells you where you are at the time. Looking at side effects, and most of us like to see what current level it takes to get a side effect. You can increase the current, and when you start to get a side effect, you then hit the circle, denote that this is an orange circle, this is a side effect. And the bottom, you see those little squares, the bottom right, and those are side effects. You can click on the side effect, that automatically notes it for you, or you can annotate one yourself. Now, this system has a nice quality to it, and that has what they call multiple independent current control. This means that each of these segments or rings has a separate current source. Over at the upper right, it gives you an example of the single source system. You can turn it on, or obviously you can turn it off. You can turn it on and you can increase the amount of current and move it into the different segments. The problem with the single source system, potentially, we don't know for sure, but we think this is clearly can be the case, is that if you have big differences in impedance across the segments, that even though you're setting a certain amount of current to be set through those segments, it may not be what you set it at. With the multiple source system, you can grade it and much more precisely, and then what you put it at, what you set it at, I want 30% or I want 40%, is what you're going to deliver. So this gives a kind of a method to give a little more precision in terms of how your current fields are distributed. Now, Medtronic has the next system I'm going to talk about, and they have 3 IPGs. There's the Percept neurostimulator, dual channel, non-rechargeable, constant current at short pulse widths. It's BrainSense technology. It's for personalized data-driven DBS treatment. You get a digital diary. You can capture patient actions and experiences, and you can get the corresponding biomarker activity at the time that they're experiencing it. Again, this is getting the biomarker activity, the LFPs, from the lead that's implanted in the brain at that target. It's a smart battery where you can predict the battery life. It has 3T and 1.5 TMR eligibility, and it's compatible with their SenSight directional lead, which I'll talk about in a minute. They have 2 other IPGs, a dual channel rechargeable, which is 15-year longevity. It is compatible with SenSight directional lead. You cannot sense with it. The Activa SC neurostimulator is single channel non-rechargeable. It is not compatible with the SenSight directional lead, and you cannot sense with it. To summarize these IPGs again, Percept, you can sense, use directional lead. The rechargeable, you can use the directional lead, you cannot sense. And the single channel, it's not compatible with directional lead and you cannot sense. Now looking at the SenSight directional lead, this is already in a 1-3-3-1 electrode configuration. You have 2 leads. One is, again, 0.5 millimeter spacing between the contacts. The other is 1.5 millimeter spacing between the contacts. That's depicted on the right side over here. This is a fully designed hardware system. It's been redesigned, and it's optimized for the LFP detection using proprietary materials, components, and processes. There's also been a redesigned burr-hole device. You can see on the right these leads, orientation markers, which allow you to provide for some feedback when you're inserting the lead into the extender wires. I want to talk a little bit more about the technology. I want to try to show you with the laser pointer the options you have here. Now, you're recording LFP activity from these targeted structures in the brain. You can look at the signal integrity. You can check it across the leads. You can get a real-time display of the LFP on your clinician programmer. You can look at custom events of snapshots that the patient has labeled. They can basically tell when they want an event. They can click on it and it'll save it. It notes medication intake. It notes the symptoms, side effects. You can do chronic LFP recording and, again, auto-annotating events and therapy changes. Looking at the clinician programming tablet here, you can grab all combinations of these segments and rings, and you click on one of them. It'll show you what you've selected. It'll give you the power spectral density. Now, you can select the frequency range you want to look at, anywhere between 4 to 100 hertz. You can do low beta, high beta. You might want to do gamma in any combination of that you select. Now, you can, again, pick on another contact selection. It'll show you a different selection over here, and then again, show you the power spectrum. You can also do it over 24 hours. In this case, what you're seeing is a 24-hour display. Each of these little dots in here is a 10-minute average of the power spectrum. So you get a 10-minute average of your LFP activity. You click on a dot, it will then show you the power spectrum. Again, you can select it between 4 to 100 hertz. The patient has selected events. You can click on the event the patient selected and get a picture of the power spectrum. Or if they change their stimulation parameters, that'll be a green square, and you can click on the green square. It'll tell you what the power spectrum did when they changed their parameters. Now, the other option this system has is they have an enhanced BrainSense survey, so you can do more electrode level comparisons, multi-rate stimulation. You can do SureTune 4 Pro software. That allows you to kind of get an automated picture of where your lead is in the target. It takes the pre and post-op images, superimposes, and the lead is then demonstrated and shown to be at that location, the target, based on the picture. You can fine-tune that to some degree, what you think may be a better representation, and then you lock it into place. Then go over and use your OptiStim and shape lock. What you do then is you've locked your parameters, you lock the location in place, now you're locking your parameters. You may want to adjust your current, and it'll show you volume of tissue activation. You can then change your, unlock it. You can select different segments or contacts, lock it again, and change the current field by increasing amplitude or decreasing amplitude of the current, and it'll give you a 3D display of this picture again of the volume of tissue activation. It'll superimpose it on the target with the lead and show you the volume of tissue activation on that picture. I've used all three of these systems. I like them all. I think they all have very innovative features. It's really going to be a matter of what you and the patient decide is best for you. Thank you.